Hey, I'm Ross. I'm a student physical therapist. Today I'm going to be going over blood pressure and RPE. So first we're going to start off with blood pressure. I'm going to discuss some indications for blood pressure. So you would want to assess blood pressure with in patients that may have hypertension or any kind of cardiovascular disease. You could use blood pressure reading to monitor the treatment of a patient with hypertension. So some of the contraindications for taking blood pressure are because usually, well, you want to take blood pressure on the left arm. So if there's an IV or the left side has an arterial venous shunt involved, or if there's any kind of deformity or surgical procedure that was done that would affect the cardiovascular system on the left side of the body in the left arm, then you would not want to do it, take blood pressure on that side. Also, if there was an axillary node dissection, you probably wouldn't want to take a blood pressure on the left side of the arm. But we have a perfectly healthy individual here today. So we have Sean, and Sean, what I want you to do is I want you to sit all the way back in the chair, put your feet flat on the floor, excuse me, and you generally want to give your patient just about 5 minutes rest before they take a resting blood pressure. So what you want to do is you want to choose an appropriately sized cuff. So we got the adult sized cuff. And Sean, could you place your left arm up here? You want to rest that arm on a strong surface, and you want to make sure that you remove any clothing in the way. So if it's a short sleeve shirt, you can generally just roll up the sleeve right here. If the patient is wearing a long sleeve shirt, you may have to remove that, because if you roll up a long sleeve shirt, it could constrict the arm and cause a bad reading. So today we got our short sleeve shirt, so we're good to go there. So what I'm going to do is I'm going to palpate Sean's brachial artery. The midline of the cuff here, it's got a little indicator, and place that in line with the artery. And I want to be about 2 to 3 centimeters above the antecubital fossa. You want to have the cuff at about the level of the heart, along with the gauge. So we're going to set that there. And you want a straight on shot at the gauge so that you can get an accurate reading. All right. And the first thing we're going to do is we're going to get an estimated blood pressure reading. So what I'm going to do is I am going to palpate his radial artery, and I'm going to inflate the cuff, and I'm going to be filling that artery. And whenever that artery disappears, I add 30 millimeters of mercury to the number that I read, and that is going to give me my estimated starting point for taking the blood pressure. Okay, 3. All right, so whenever I put on the stethoscope, I'm going to place it right here on top of the brachial artery, and I'm going to be listening once I pump up to the estimated blood pressure and release at 2 to 3 millimeters of mercury per second. Once I hear that first sound, the first thump, that's the first carotid cough sound, that's going to be my systolic blood pressure. And then I'm going to continue to control the release of the cuff until I no longer hear the carotid cough sounds. So on that last thump, before it goes quiet, I'm going to make a reading of that, and that'll be my diastolic blood pressure. So when you're using a stethoscope, you can use either side of this. So make sure that you have the right side, and it's very sensitive, so you'll know which side is turned, because you can also rotate it here and use the other side. So I'm going to inform the patient that we're going to have to be quiet while I take the blood pressure. That way I can get an accurate reading. And then you just go ahead and inflate the cuff. Inflate the cuff to the estimated blood pressure. All right? And you can just use this valve right here to close and open it. All right? So the reading was 116/66, so that is a good reading. So a normal blood pressure would be less than 120 systolic, less than 80 diastolic. Pre-hypertensive would be considered between 120 to 139 for systolic, and between 80 and 89 for diastolic. So hypertension stage 1 would be considered 140 to 159 for systolic, and then hypertension for the diastolic would be hypertension type 1 would be 90 to 99, and then stage 2 would be 160 or greater for systolic, and it would be 100 or greater for diastolic. All right, so now we're going to talk about RPE, and RPE is a way to gauge impeding fatigue during exercise for a patient. So I got a scale right here for you to look at. This is the RPE scale. It's a good supplement to heart rate during exercise. It's actually directly correlated with heart rate. I guess the only contraindications would be possibly if the patient were blind. So we have Sean here, and Sean is going to just do a quick 10 push-ups for me. Thank you, Sean. You're the man, by the way. And when he gets done, we're going to give Sean an opportunity to rate himself on the RPE scale. So where do you place yourself on the scale as far as exertion? A 9? All right, so Sean chose a 9. And a 9 is considered very light, 6 being the low on the scale and 20 being the high. So 6 would be no exertion and 20 would be maximal exertion, and Sean chose a 9. So I would record that, and then maybe down the road we would do the same exercise, and if Sean is more conditioned, then he would most likely put a lower number for that. Anyway, that's the RPE scale.